Hi, my name is Dr. Lowell Wild Jr. I am a podiatrist with over 20 years of experience helping patients throughout the Chicagoland area live a better life by removing people's bunions using a very unique procedure. When many people think of podiatry, especially in Chicagoland area, many people think of the name Weil. My father, Lowell Weil Sr., has been practicing as a podiatrist for over 50 years. Additionally, he invented a unique procedure for bunion removal in 1984 that has long-term success and allows people to return to shoes in as little as 1 week. He is the CEO and founder of the Weil Foot and Ankle Institute, where we have over 20 locations throughout the Chicagoland area. Now, I am super excited to be talking to you about how you can finally get your bunions removed with a unique procedure that, in fact, my father invented. So today, we are going to cover the myths and misconceptions of bunions. We are also going to cover the cause of bunions. You may be surprised to know that bunions aren't caused by anything that you have done. We are also going to talk about our unique procedure of how we remove bunions in less than 30 minutes, which is about half the time of traditional bunion surgery, and how our procedure will allow you to get back to wearing your fashionable shoes within 6 to 12 weeks, whether you wear high heels as a woman or dress shoes as a man. This is the same procedure I performed on the supermodel Skye NELLOR. Skye had bunions on both feet. With traditional bunion procedures, you can only have one foot done at a time. With this unique procedure that our podiatrists perform at the Weil Foot and Ankle Institute, you can have the procedure done for both feet during the same surgery. So Skye is a supermodel, and obviously being able to wear heels and fashionable footwear is critical for her career. However, her bunions were causing her much pain. She flew in from Los Angeles to have me perform the procedure, which took less than an hour for both feet. This is Skye's picture before the surgery. This is Skye's after surgery picture. She was able to wear high heels again without pain. We perform the incision in a very unique spot and make a very small incision. Notice that the incision is on the side of her foot, so from the top you can't even see the incision. From the side, it's even hardly noticeable. This incision is an incision just like cosmetic surgeon would make. Many surgeons do not consider the importance of aesthetics when making incisions like we do at the Weil Foot and Ankle Institute. Skye said, and I quote, "Everyone I show my feet to, even other doctors, are amazed. I am so happy. Also, a friend of mine, Marjorie, saw my feet and wants to schedule the same surgery." Bottom line, by the end of this webinar, you will know more about how you can uniquely remove your bunion or bunions. In situations where you are not a good candidate for our unique procedure, we have other procedures we can perform as well with successful results. So at this point, you may be wondering, why am I sharing this information with you via webinar? Well, at the Weil Foot and Ankle Institute, we always take a consultative approach to treatment. We love to educate our patients about their options and together decide which treatment options make the most sense. The goal of this webinar is to educate you on your different options for bunion removal, and if the information I talk about resonates with you, at the end, I will invite you on how to take the next step and schedule a consultation, which, by the way, is covered by insurance. Now, if you are like me, chances are you will have some questions as I talk. Simply type in your questions as you have them, and I will do my best to answer them at the end. I know we have a limited time together today, and I want to make sure I get through all the information I've prepared for you. I want you to turn off your cell phone, close your email, and shut down Facebook. Give me your focus and pay close attention to this presentation today, because the information you are going to learn today can literally change your life. You can learn how you can wear fashionable shoes again and get back to your lifestyle without any more pain that you may be experiencing from wearing certain type of footwear or activities. You absolutely don't want to miss anything. Clear all your distractions so you can focus on the content of this webinar. I promise you, you will be grateful you did. So why is this presentation so important right now? If you are watching this presentation, chances are you currently have a bunion. Ultimately, I want to show you that you don't have to suffer from your bunion anymore. We have multiple procedures that can help you remove your bunion. Like I said earlier, my father invented a procedure to remove bunions in less time and with less pain. We will talk more about this procedure later on during this webinar. Also, we have published multiple studies and articles in international trade and research journals trusted by podiatrists and orthopedic surgeons throughout the world about how we are successfully removing bunions at the Weil Foot and Ankle Institute. So for you, who is watching this webinar right now, you are benefiting greatly by having years of research, thousands of patients that our Weil podiatrists have helped, and the newest and most advanced, innovative techniques to eliminate your bunion. Additionally, we have lectured internationally on our bunion removal techniques. This is a picture of me graduating from the Scholl College of Podiatric Medicine in 1994. When I was learning how to treat bunions in podiatric medical school, the technology that we use today at the Weil Foot and Ankle Institute was not available. An interesting story is that during my fellowship in Europe, many of the doctors were asking me about how to perform the surgery my father invented for bunion removal. So it was ironic that here I was in fellowship teaching the people who were supposed to be my mentors. So for those watching this webinar right now, you are benefiting greatly from the years of experience we have had in helping people with the removal of their bunions. But right now, I want you to take a moment and imagine your life would be like without having your bunion. For some of you, that would mean being able to put on your running shoes without your bunion rubbing up against the shoe. You could get back to your more active lifestyle. For some of you, it would mean being able to wear your high heels at work and getting through the day with no pain. Additionally, just think about being able to wear all those great shoes in your closet again. For some of you, it might mean being able to go on walks with your children or grandchildren without pain. For some of you, simply being able to go shopping without your feet hurting. I want you to think how it would feel for you to not be embarrassed about how your feet look. What would it feel like to have your bunion finally removed and be able to wear fashionable footwear without pain? Absolutely amazing, right? Obviously, that is one of the reasons why I am a podiatrist today. I love seeing our podiatrists at the Weil Foot and Ankle Institute being able to correct bunions from people who are living in pain, discomfort, and oftentimes are embarrassed by how their feet look. Most podiatrists don't perform this unique procedure that my dad invented, which I'm going to talk more about with you later on in this webinar. This is a procedure that we have honed at the Weil Foot and Ankle Institute. Now, how will your life be if you don't learn about this information that is so important and get your bunion corrected properly? If left untreated, your bunion will inevitably get worse. Usually this leads to more pain and limitation of shoe gear. Pictured here is a patient who let their bunion go untreated for many years. The good news is, with this procedure we perform at the Weil Foot and Ankle Institute, the correction of your bunion is relatively painless. Typically, it takes less than 30 minutes per foot. Many times you can get back into your gym shoes in as quickly as 1 week after surgery and your normal shoes within 6 to 8 weeks. Before we get into the details of how we correct bunions so differently, let me share with you a little bit about my background and how I became a podiatrist. From a very young age, I've always wanted to be a podiatrist. Since 1965, my father has been a podiatrist. When I was a little kid, my father used to take me to the hospital to do patient rounds. I remember him pushing me through the halls of the hospital in a wheelchair and being so gratified about the whole experience. Like most kids, I always thought it was a great day when I visited with my dad at work. During summers in high school, I would help with the filing at his office. I always assumed I would follow in my father's footsteps. My father had been the podiatrist for the Chicago Bears for years. I eagerly tagged along to practice whenever possible. The summer before my junior year of high school, the assistant trainer for the Bears, Brian McCaskey, asked me if I'd be interested in being part of the training staff during the season. For the next 2 seasons, I helped in the training room and locker room before and after every Bears home game and even some away games. During games in the 1984 and 1985 seasons, I was actually the water boy. As the water boy, during the timeouts and during the 2-minute warning, I ran onto the field and was in the middle of the huddle in front of a stadium full of screaming fans. The 1985 season ended with a Bears Super Bowl victory. The thing that resonated most with me was the importance that the team and the players placed on all the doctors, including my father. The players talked to him with great reverence, and after games they would thank him for helping them. Hall of Famer Walter Payton was particularly fond of my father. You can imagine how impactful this all could be on a 16 or 17-year-old teenager. This was certainly a defining experience and further helped me want to become a podiatrist. I went on to graduate from Vanderbilt University and attend the Scholl College of Podiatric Medicine in Chicago, where I met my eventual wife, Wendy, who is also a part of our practice. I then attended residency at the Graduate Hospital in Philadelphia that was part of the University of Pennsylvania network. Following residency, my wife and I traveled through Europe, visiting and training with 25 of the most well-known foot and ankle surgeons of their time. Meeting some of the world's best foot and ankle surgeons was an incredible experience that has shaped a lot of what I have done in practice. As a physician, I have always lived by my father's teachings that you are never good enough. You always have to study, learn, and find better ways to improve the lives of the people who trust you with their care. I have lived by this philosophy throughout my entire career. As a result, I have become very involved with research and have published over 50 articles and book chapters. I have served as the editor of Foot and Ankle Specialist, the only combined orthopedic, podiatric, peer-reviewed journal in the world. I have lectured in 11 countries, on 5 continents, and in 25 different states. I have pioneered new procedures and implants to improve the care of patients, most notably the complete plantar plate repair system. I have been the fellowship director at our institution, which is the longest running fellowship in our profession, and has graduated more than 20 fellows. At the Weill Foot and Ankle Institute, our mission is to provide outstanding foot and ankle care in Chicagoland and throughout the entire country. I have personally trained many of our podiatrists at the Weill Foot and Ankle Institute on our unique bunion correction surgery. So now that you know a little bit about my background, let's talk about some of the misconceptions and myths around bunions. I'm going to share with you 7 common misconceptions we hear about bunions. The first misconception we hear from many patients is that they did something to cause their bunion. Many people think that certain activities like dancing or ballet or even wearing high-heeled shoes cause their bunions. But in actuality, bunions are 100% genetic. Even if you knew as a child that you would develop bunions in the future, there was nothing you could do to prevent them from forming. Another misconception we hear from patients is that if you correct a bunion, it will eventually return. Thankfully, in nearly all cases, this is not true. The world literature shows that 11 to 15% of bunions that have been corrected will return. Research from our institution on our procedure show a recurrence rate of less than 5%. Another misconception we hear all the time is that bunion correction is terribly painful and will keep you out of work for an extended period of time. Our patients report minimal discomfort after surgery and throughout their entire recovery. We accomplish this by a combination of anesthetic techniques, surgical skill, postoperative medications, and aggressive recovery protocols. Additionally, most of our patients return to their working environment with only 2 to 3 weeks after surgery. Another misconception is that you will need to wear a boot or cast after your bunion surgery. While with most bunion surgeries this is true, with the need to utilize a boot or cast for 4 to 6 weeks following surgery, the procedure performed at the Weill Foot and Ankle Institute allows patients to return to comfortable athletic shoes as quickly as a week after surgery. Another misconception is that age is a factor in whether you should get your bunions corrected. Many people assume that they are too old or too young to have their bunions corrected. Older patients think that the recovery will be too rigorous for them to handle. However, we already discussed that patients return to weight-bearing status in comfortable shoes in as little as 1 week. Younger patients think they should wait to get their bunions corrected because they fear the bunion will come back. We talked about the low number of incident of recurrence with the procedure performed at the Weil Foot and Ankle Institute. Another misconception is that your foot will never be the same after bunion surgery. This actually might be true. Most patients tell us that they have a new foot after the correction that allows them to wear their favorite shoes again and allows them to do the activities that they couldn't do before their bunion correction. Many people say they wish they had corrected their bunion years ago. The seventh misconception is that you can't have both of your bunions corrected at the same time. While with most bunion correction surgeries, you typically cannot correct both feet at the same time, the surgery that we utilize at the Weil Foot and Ankle Institute allows for both feet to be corrected during the same surgery. We performed and published a study comparing the correction of one foot at a time versus both feet at the same time. There were 186 patients that included 252 procedures, as 66 of the patients had both feet done at the same time and 120 people had only one foot corrected. People didn't complain of more pain with having both feet done compared to just one. In both groups of patients, their pain was minimal. There was no difference in either group of patients returning to gym shoes, which was no difference in which 90% of the patients were returning to shoes at 1 week. There was no difference in patients returning to work, which was in both groups less than 3 weeks. There was no increase in complications when performing surgery on both feet. However, there was a big difference in overall medical cost. The group who had both feet done at the same time had an average cost savings of more than 40% compared to if they had one foot done at a time. In today's healthcare environment, with patients having higher individual deductibles and responsibilities for cost, this becomes even more important. Generally, you have to cut and move bones in the foot to correct a bunion. Screws or plates are placed in the foot to hold the position. There are literally hundreds of different procedures to correct bunions. About 20 procedures are commonly used today. One of those 20 common procedures used today is the one my dad pioneered in 1984. This procedure redefined how bunion surgery is performed as well as the post-operative recovery. This procedure in particular changed how the bone cuts are made and how the bone is repositioned. This method is the most stable way in which the bone can be cut and moved. As a result of this technique, most patients are allowed immediate weight bearing and return to closed shoes in only 1 week after surgery compared to 6 weeks of wearing a cast or boot with typical correction. This technique also allows for both feet to be corrected at the same time and start physical therapy only 1 week after surgery. Also, with physical therapy starting sooner, there are less post-operative problems such as weakness and stiffness. Our method requires no sutures to be removed, and one can return to normal bathing only a week after surgery, getting the foot fully wet. Additionally, you can drive a car in as quickly as 1 week after surgery. You can return to non-weight-bearing exercise at a week after surgery and weight-bearing exercise such as walking and running as soon as 8 weeks after surgery. Typically, patients return to fashionable shoes as soon as 6 weeks after surgery and high heels in 10 to 12 weeks after surgery. In other types of bunion correction surgeries, many doctors will discourage their patients from ever wearing high heels again. We also put our scar on the side of the foot so when you are standing barefoot, the scar is not visible. We accomplish this by using cosmetic surgery techniques to make the scar virtually invisible once it is healed, and we showed earlier with supermodel Sky NELLOR. Because our procedures typically take less than 30 minutes, which is less than half of traditional bunion surgery, our surgeries require less anesthesia and it is easier to wake up from the procedure. I recommend that you come in and see if you are a candidate for this revolutionary procedure by having a consultation with one of our podiatrists at the Weil Foot and Ankle Institute. We can go over more of the details with you in person. In the unusual instance that you are not a candidate, we do have other treatment options as well to correct your bunion successfully. At this point, you are probably wondering, does insurance cover this procedure? Nearly all insurances cover the correction of painful bunions. If you happen to have a higher deductible, we do offer 0% financing and accept major credit cards to cover your responsibilities. For people who have bunions and come to see us for our unique procedure, most are good candidates. Nearly all people who move forward with the correction have favorable results. At this point, I want to show you a before and after photo of a patient. This is a picture of Doris's before surgery foot. Doris is a 72-year-old lady with an obvious bad left foot. Additionally, Doris suffers with osteoporosis. Because of her osteoporosis, she needs to maintain an exercise regimen on a daily basis and prefers walking. Her foot became problematic to the point where walking was no longer tolerable. She was having pain into the bunion as well as to the second toe that was crossing over her big toe. She came to me wishing to have a corrective procedure that would allow her to return to walking as quickly as possible. On the right picture, you can see Doris's foot immediately after surgery compared to the before picture on the left. Doris was able to put weight on her foot immediately after surgery to get around her house and return to her athletic shoes 1 week after surgery. She vigorously participated in physical therapy and modified her exercise by using a recumbent bike starting a week after surgery. She returned to her walking routine 7 weeks after surgery. Recently, I saw Doris and her daughter for the 1-year checkup, and she couldn't be more pleased with her result and the process that got her there. Today, Doris is wearing shoes that she hadn't worn in years and doing all the walking that she desires. This is a before and after of Kathy. Kathy is a 45-year-old marketing executive who needs to wear a variety of shoes, including high heels, for work. She is an exercise enthusiast who works out 4 to 5 days per week, including Zumba, CrossFit, and running. She began having pain years ago and started purchasing shoes to accommodate her bunions. Even those shoes started to bother her, and exercise became more uncomfortable in her feet. Furthermore, she was embarrassed by the way her feet would look when wearing sandals and going barefooted. She came to me looking for a solution that would minimize her time away from work and return to exercise as quickly as possible. We discussed her alternatives, including a realistic time frame to return to work and the type of exercise she enjoyed. To minimize the overall recovery, she desired to have both feet corrected at the same time through our unique procedure. Her surgery lasted less than an hour, and she was home before noon on the day of her procedure. She returned a week after surgery to have her bandages removed. She was put back into her gym shoes on that visit and started physical therapy. Over the ensuing weeks, she modified her exercise routine and participated in yoga and rode a stationary bike daily. She was able to return to work in a mostly seated capacity 2 weeks after surgery and increased her standing and walking at work on a weekly basis. She returned to a fashionable shoe for a couple of hours 6 weeks after surgery and was able to wear her fashionable shoes full-time 9 weeks after surgery. She even wore high heels to an event 10 weeks after surgery. At 7 weeks after surgery, she started to walk for exercise and progressed to all of her impact exercise by 12 weeks. She says that she really never had any pain after surgery, but it took about 5 months for the aches and pains to fully go away. So at this point, you may be wondering, who can help you determine if you are a candidate for our procedure or alternative treatments. You can confidently come to any of our Weil Foot and Ankle Institute locations and talk with a podiatrist about your unique bunion. We accept most, if not all, insurances. Your initial consultation is covered by insurance and the surgery is covered by most insurances. So simply call us at 847-257-1224 to schedule your initial consultation. At this point, we have time for a couple of questions. Let me see what questions we have here. Looks like we have a bunch of questions. Here, this is a great question. If I have both feet done, how will I be able to take care of myself? Well, that's a very common question. Our unique procedure allows you to put weight on your foot immediately after surgery without the use of crutches or a walker. You will be able to walk from your bed to the bathroom, to the couch, and to the kitchen with minimal problems during the first week. You can even go up and down stairs once a day. So even our patients who live alone have told us that the first week wasn't too difficult to take care of themselves as long as they prepared ahead of time. We will go over exactly how to prepare your environment before your surgery. Another question we have here is, do I really need physical therapy after surgery? This is another common question I get when I talk to people about their surgical recovery. It's funny, but for some reason, foot surgeons do not use physical therapy as frequently as shoulder or knee surgeons. Yet we expect to stick our foot back into a tight shoe and walk on it all day long. We have been utilizing physical therapy for more than 10 years after our bunion correction and have seen improved results since that time. In fact, we performed a study where we compared patients who had physical therapy after bunion surgery to those who didn't have physical therapy after surgery. At 1 year after surgery, the group that had participated in physical therapy reported better results than the other group. Let's see here. We have time for one more question. If your questions didn't get answered, or if you still have a question, please put your question in the chat and one of my team members will follow up with you promptly. So here's our last question. What if I'm not a candidate for the procedure you talked primarily about during the webinar? Well, there are a lot of factors that go into why one might not be a candidate. It could be that your bunion is such that it is not amenable to this procedure. In other cases, it may be that the bump near your big toe is not a bunion at all, but actually an arthritic condition. No matter what the cause of your pain may be, we will be able to discuss and offer an option that will take care of your problem. So with that, I invite you and everyone on this webinar to schedule your initial consultation with one of our podiatrists by calling 847-257-1224. No one should be suffering from their bunion. We realize how pain from your bunion can affect your life in so many ways. Life is busy. So get better faster and come in and see us. You owe it to yourself, your family, and friends to have healthy feet. You deserve to correct your bunion once and for all. Thanks for your time today, and I hope this webinar has taught you a little bit more about the Weil Foot and Ankle Institute. On behalf of my entire team of doctors and our entire staff at the Weil Foot and Ankle Institute, we look forward to treating you. Thanks so much.